and welcome back to the channel. Today we have another special treat for you guys. We're here at Ultimate Cryotherapy. And we're gonna be doing our second session of our Cryo T-shock, which is the fat reduction machine goddess. So I'm also gonna be showing you guys the results. So let's get started, come on. Hi, how's it going?
Good, how are you?
Great. Oh, I'm so excited. It's been 10 days, guys. 10 days since I've been out here.
Okay.
Yeah. So we're here for our second session.
Second session, yep.
And oh my goodness, the results have been amazing.
Yeah.
So, you know, like I had a few of my followers asking more about like the different things that you have here in your facility,
sure.
Not just a Cryo T-shock. So if you wanted to give us a quick little tour before we get started.
I would love to. I love my place, so I'd love to talk about it. Again, you can see, obviously, waiting room. Try to make it very upscale. We're in East Boca, so got the nice paintings on the wall, and of course, Bobby's our mascot over here.
Is that his name, Bobby?
That's his name. I actually made Bobby myself.
No, you did not.
That is a true story. Very artistic person.
Like the face and everything?
No, I bought a mannequin that was in pieces. I used Bondo they use for cars and put it all together, glued it all together. I used the popcorn ceiling texture on it, glued the spikes to them, painted them, glossed them.
Jeez, okay, did you see them? Awesome.
So what we got here, just, you know, a lot of different, everything we do here is for health and wellness. So we have in here is our IV room. So we do.
So you guys do IV also?
We do. We're just starting. We just got our medical director. He's just signing the papers to get him on board. So we're going to be doing all the different B12s, the C's, the Myers cocktails. But we also do very high end with amniotic cells, as well as exosomes. So for anti-aging, for professional athletes, a lot of people have like just been beating up their bodies over the years. Great for regenerating tissue and everything in your body.
Oh, so absolutely. I've done it in the past and it's been amazing.
Yeah.
So maybe next time.
Yeah, definitely. That and HRT, we're going to start doing the hormone replacement therapy as well.
That too?
Yes, doing that as well. We got a procedure room in the back as well for that.
That's crazy.
So we got that here, and then when you come out here, we have the, this is our procedure room for where you're doing your stuff. Which is the cryo sculpting. You
guys have already seen this room before.
Yeah, this is where it all happened the last time. So we got the cryo sculpting. We also do cryo facials in here. So all wrinkles are is basic collapsed collagen that the skin folds in on. This hits it really hard, damages it more. Body replaces it with new fresh collagen, plumps it up, wrinkles go away.
So for like face wrinkles?
Yeah, face wrinkles, correct. Yeah,
interesting. So that one machine does all that?
No. This does do facials as well, but we have a different machine that does that.
Okay.
We have two different machines in that machine. We also do spot treatments, pulled hammy, bad back, bad shoulder. We hit it one spot for 10 minutes as well. It takes all the swelling out. So we do that as well in conjunction with the big cryotherapy. So
that's crazy.
Yeah, we do both. And then in here we have our infrared sauna.
So I've heard a lot about the infrared saunas. What exactly do they do compared to like the
regular saunas?
Yeah, like the regular saunas.
Regular sauna, same type of thing. You're gonna get it very hot in there. It's made to sweat everything out. Difference with infrared and the other one. The other one uses moisture and everything, water, stones, whatever you're doing, and that heat just makes you sweat from the surface and gets the sweat out. So what this does is this actually uses infrared light to bring that 140-degree heat into your body. It penetrates up to 3 inches into your body, so your organs, your liver, your kidney, all that stuff, takes all the heavy metals, pesticides, toxins from inside and even your organs and gets it all out of your body.
And then how long are you in there for?
30 or 60 minutes. Most of the time it's 30. You know, we got some people in here that are going in there for 60 minutes, but great for detoxing, great for cardiovascular as well. NASA with the astronauts before they go into space, they do this for 2 months for their cardiovascular system.
Interesting.
Yeah, vasodilates all your body, gets all the good blood flowing, and gets your heart, everything in good condition.
So much for rejuvenation. And
exactly. Everything about here is health. It's all health related. Yeah. And then obviously, you've never done this before, have you?
Yes, I've done it once.
You did.
I've done it once. I've been at another place another time, but like I have like low circulation on my limbs, and I get cold really easily, and I'm like in there for like 2 minutes, just like those 2 minutes are so hard for me. But I know I did feel really good after doing it. So
well, people like you, we do have 2 sets of gloves, 2 sets of socks for you, so when you go in there, it's not going to affect your extremities. But 3 minutes in here, it was actually invented in 1978 for rheumatoid arthritic patients. So it takes all the swelling, the pain, inflammation out of your body. So great for athletes like yourself. It takes all that out. It's great for building your immune system. So even right now with COVID going on,
100%.
this is, you know, cold plunges that people use or cold showers to build their immune. To the 100th power, it goes down to minus 240. So great for building your immune system.
How often should a normal person do this treatment?
It depends on the athlete and what they're looking to get out of it. If it's a real athlete, somebody's beating up their body a couple of times a week. I've been working out 38 years. I'm arthritic in all my joints. I do it 3 times a week. That's the max. I would say anybody do. We have people that come in 5 days a week. To me, that's overkill. But if they want to do it, that's fine. But it's great. Normal person just working out in the gym, 40-year-old man or woman, just come in once a week at the end of the week to rejuvenate your body and get ready for the next week's workout.
That's awesome. Yeah, I've done it like, I saw the benefits and I'm like, oh, I need to just get over the coldness. But no, absolutely. I definitely saw the results right after. I felt much looser and everything else. I do.
It jacks up your metabolism and it also releases adrenaline and endorphins. So when you get out of this for the next 2 hours, you got a lot of energy, you feel great, and the endorphins make you, it's like kind of a euphoric feeling. So it's even good for people with depression, people who are in rehab, because it gets kind of like a natural kind of high. So it's really good for a lot of things.
Awesome. Awesome. Perfect.
Yeah, and then last is the procedure room, and that's again for the HRT.
More?
Yeah, we just built this. And this is our procedure room for, again, HRT, in case people want to get the injections here. Doctor could come in and give them the injections, or again with the amniotic fluid, the exosomes, if there's a particular area, their shoulder, their knee, that's hurting them, they want a direct injection there, we can do that as well.
Okay, so let's say you have like chronic pain, like on, for example, your shoulder. Is that treatment going to be something good for them, or?
It depends on what it is. You know, if it's arthritis, like stage 4 arthritis, and it's bone on bone, you know, we could do it. It may give you some relief for 6 to 8 months. You may have to keep coming back and getting them. But that's the nice thing about having the doctor on here. We do a consultation.
Awesome.
Doctor, we do blood work right here. We're going to have a machine that reads the blood work within 10 minutes in here.
No way.
Yeah, so you don't even have to wait, nothing. So, and then the doctor will do teleconferences and you know, take care of them that way.
That's awesome. And that's the same thing for the HRT and everything like that. Everyone's hormones can be optimal, which is something that a lot of people are, I'm really afraid of when it comes to like hormone therapy, because they're like, oh, it's not natural or whatever. But
the thing is with a lot of people, like females, when they get older and they go through their changes, you know, they got the estrogen, they get all this stuff. Guys, you know, we go through the same kind of stuff. You know, our HGH levels go down, our testosterone level, a lot of our levels go down with hormones, but nothing over the years has been done for us. So now this is a way for us to get our hormones back up to where they need to be and make us happier and more energy and less depressed and clearer mind. It's got great advantages to it.
Yeah, it's kind of like feeling back to when you were like 25, essentially.
Exactly.
Yeah, so you're not feeling well. HRT might just be for you.
That's it.
So.
Okay, and that's all we do. So.
Awesome.
We'll bring it back to the front and let's get you going and get you all worked on.
Oh, I'm so excited. Okay, guys, so I'm super excited to actually show you this, because after 10 days, like my glutes have actually gotten more defined. And you know, like the areas that we're working on are the side of the glutes. So, but as of right now, you can see a good amount of definition. And I'm gonna put the pictures of before and after as well, so you guys can see and see the differences. So, but yeah, we still need to get a little bit more on that side glute, like we did before, and then yeah.
So we want to hit more of the side over here.
Yeah, so it's more of, so let me see, if I go here, it'll be more of this right here.
You can definitely see the outline.
And, yeah.
Okay, so if you don't mind, do a little artistic drawing on you here. Could you bend like you did before, so we get a little bit more of a shot? All right, perfect. We got it.
Awesome. Let's get started.
So as you can see, we've got the machine set already. We've got the gel on here. It's kind of like an ultrasound. That's going to help the cold penetrate under the skin and get it through a little easier. And yeah, about a couple of minutes first to heat everything up. It's getting all those fat cells nice and warm. And it's going to quickly switch, get down to like -1 or 2 degrees for 22 minutes. And that's going to really shock them, kill them, and that's going to process out of your body. And then we'll have heat DM to try and get them to release. So that's the whole process.
Yeah, I've been getting questions about whether it hurts or not. No, it does not hurt. It's just cold and then it gets hot. But it feels fine. Like I'm not in pain or anything like that.
No, not at all.
Yeah, so right now it's hot. And once again, it's not an uncomfortable hot. Like it feels fine. Like it's not something that I'm like, oh my goodness, please stop. And I like the cryotherapy where I'm like, oh my god, it's too cold or it's too hot. Like no, this is actually, it feels nice. It's like a little massage.
Yeah. That's what we try and do. We try and massage the whole way through is kind of like a massage. We do put pressure. It's not like I'm going easy on this. I do put pressure on this when I do it, and it massages the muscle and the fat too and gets it all off quicker.
Yeah, so I had a question. So during this video, I'm gonna go ahead and actually answer a lot of the questions that you guys put from the last video. So if you guys have any questions for the next treatment, because I had 3 treatments, this is my second one, make sure you guys comment below so we can answer those for you. But one of the question was, I've always wondered about this, is it a semi-permanent thing or do results vary?
No, it is a permanent thing. As you know, when we're born, or maybe you don't know, when we're born, we have a certain number of fat cells that are there. When you lose weight or if you gain weight, it's not that you're gaining more fat cells or losing fat cells. It's the fat cells that you have are either getting smaller or bigger. So what this does is it actually kills the fat cells and permanently gets them out of your body. Once they're gone, they're gone. Now that's not to say, Barry, you said? What was the guy's name?
No, it was a girl, Dusty.
Oh, I'm sorry, Dusty, I'm sorry. That's not to say that if you eat 6 cheeseburgers the next day, that the fat cells that are left are still going to expand and get big again. But you do have less fat in that area permanently.
Yeah, and I actually noticed this last year with one of the treatments that I did. We did it kind of quick, and right now we're being more strategic with the treatment, so we make sure that these fat cells pretty much stay away. But when I did gain back my weight, I did notice that that area was a lot leaner than it has ever been. So I definitely saw really good results, and that's the area for me that is very, very stubborn. So would you say that with stubborn areas, you're just gonna have to you might have to come back later on if you do gain weight then?
Yes and no. I mean, the whole purpose of this is when you come in, we'll do a consultation. And I'm perfectly honest with you, Steffi, this is not for everybody.
Right.
It's for specific people who are, in shape, but have, like you said, problem areas, stubborn areas. Once we do this on that stubborn and problem area, that fat is gone for good. So you shouldn't have to come back again. Now, it may not be the one treatment to get you where you want to be.
Gotcha.
You may have to do 3 or 4 treatments or 5 treatments to get there. But once you're there, you'll be fine after that point.
Right. I mean, honestly, I just needed to come down in weight too.
Yeah.
So, once I did drop the good amount of weight where I'm comfortable at, I did notice that my glutes were leaner than they were last year before I did my treatment at the same weight. So, do you need a physician's referral to do this? Or is it good to talk to a doctor before coming in?
Yeah, it's always good to consult a physician, but if you're a healthy person and you have no issues going on, then there's no doctor, needed for this, no prescription, nothing like that. It's just a, machine, we're a med spa. We do have a physician here, but for this, you don't need a doctor's approval or anything.
So one of the most common questions I get asked as well is, your food, your diet, your water intake. So let's start with, what should your diet look like the day before coming in and throughout the day today and then tomorrow?
Honestly, Stephanie, the nice thing about this, you don't have to have a certain diet per se. But what you don't want to do is, after you finish this, is to eat too much carbohydrates right afterwards. Okay. You want the body to start to get processing that fat, using it and get it out of the system. So no carbs afterwards. Obviously, water should always have a lot, especially after this. You need a lot of water to flush out your system, get everything out of your body. Because this is going to go through your lymphatic system. So not part of the question, but part of an answer to as well is after you finish this, you want to do something to stimulate your lymphatic system. You know, like your circulatory system, you got the heart that pumps and it constantly keeps things moving. Lymphatic, if you're not using it, it just kind of lays there. So after this is done, to get it rolling, you do want to work out. We have a shaker plate in here as well, so we'll do that for 15 minutes for our customers. No charge. You're on the shaker plate, get your body going. Or you can do the cryotherapy machine, which again gets your lymphatic system started right away. So one of those three things after you finish with this is the best thing to do.
Awesome. So the day before you can eat whatever you want.
Yeah.
It's just after the treatment you want to make sure that you have low carbs or fat's okay, like just high protein, like more keto wise.
Exactly. Yeah.
So if you
keto.
Okay. So then no carbs until like maybe like later at the evening or
3 to 4 hours without carbs afterwards.
Okay.
You know, you don't want anything like that. You don't want anything your body's going to start producing fat right away again, right afterwards. You want to get it all out of your system first of all.
So the longer the better, essentially.
Exactly.
But then the next day you're pretty much good to go back to your regular diet with your carbs.
Yes.
Okay, awesome. And then the cardio should be done in a window of like right after.
Right afterwards, yes.
Okay.
Working out within the first half hour.
Okay.
You want to either work out, shaker plate, or cryo machine, one or the other. Something to get your lymphatic system moving.
Makes sense.
Start processing the fat cells out right away. And then in between sessions, you gotta wait at least 10 days to 2 weeks.
Right.
Because we don't want it to be toxic in your system. We want to get all the fat out before we release more,
So what is the longest time that you can wait?
Again, every 2 weeks you should be doing it until you get to the results that you want to get to. We have a lot of people that come in here, and unfortunately I explain this to them. And it's not cheap. I mean, I admit it's it's not a very inexpensive, but you drop it 10, 20 bucks. But a lot of people come in for one session, they think one session's going to do it, and it's really not.
No.
You'll get some, some results, but not what you're going to want to see. So again, that's the consultation comes in at that point. I'll tell you, you're going to need 2 to 3, 3 to 5, 5 to 8, whatever the case may be, and then we'll discuss payment options after that point to make sure we can afford it, people can afford it.
100%.
We'll work with you guys.
Perfect. So let's say that, because we were planning on doing the next step was going to be the tightening.
Right.
So can I wait longer than 10 days, or should I just come in before the 10 days and get the tightening done?
No, you can, with the tightening part, you can wait longer than the 10 days.
Okay.
The reason we're doing the tightening with you is you have a specific schedule that we want to hit you for a certain day to look the best you can look.
Right.
So we're going to do it like 2 days before your next show. Tighten it, give your skin 2 days to calm down, and that'll be the best result for you. But normal person coming in, just if they want to do the tightening a month afterwards or whatever, it just gives the skin some time to calm down a little bit, and then we'll hit it with the tightening.
Okay, so if I do have a show, let's say like 6 weeks from now, which is way over 10 days, would the tightening still work?
Oh yeah. Well, yeah, because once it's tightened, it's permanent. It's going to stay that way.
Okay, so even if I decide to come, because I know we spoke about like doing it 3 days before the show.
Right.
But if I decided to do it like 10 days before the show, or would I still have the same benefits, or should I still just wait to the closer to the show to have the best results?
I would rather do closer to the show to give you the best results, because again, the longer you're going to go, the more time it's going to give your skin to stretch out, or if you go off the diet. Now you're probably not going to go off the diet because you got shows to do, but I'm talking in general with normal people or so. If you shoot for one show, we want to hit everything right for that show. You know what I'm saying?
Makes sense. Awesome. And I know you spoke about like cellulite reduction and people with like a lot more stubborn areas. So if it's somebody that comes in that has, I have maybe like 10-12% body fat, but someone comes in with like 30% body fat, do you recommend them to first like drop the weight and come in, or just come in and do the sessions either way to try to burn off the
You can do it either way. I would prefer, in a perfect world, that they lose whatever weight they can at first. That's the best way to do it, because then you can really see what we're working with what's left. So
because it might not be the stubborn area. In that area,
exactly.
might actually just need the extra time.
Exactly. And like I said, we want to do a concept. If they got fat all over their body, this is not really the thing for them. If it's someone that's 30-35% body fat and they're heavy throughout their whole body, this is not for them. Diet, exercise is the way to go. And then if there's a problem area left overwards that they're not losing it from, then hit it with this afterwards.
Makes sense. And it's so nice that you're so honest about it, because I feel like a lot of people would just be like, oh no, definitely get it done, and it might not even be a stubborn area that the person may have. It might just be an area that just needs a little bit more time with the diet and the training, and then to see where that area is actually stubborn. Like for me, like, I mean, obviously whenever I go for my off season, I put on body fat a little bit everywhere. Obviously my legs and my arms and everything, but if I came in and decided, okay, I'm gonna do my whole body, would it actually give me this, you know what I mean? Like when I do now, it might not give me the same physique that I actually want.
Right. No, and it's not. And you know, you're different. You know your body. You're a competitor, so you know your body very well at this point. The majority of the people that we get coming in here, they're not competitors. They're an average person who's lost weight, and they've got like the chicken arms, chicken wing arms. So
does this machine also help with like tightening up? Like, you know how when you drop a good amount of like body fat and you have that loose skin?
Yes.
Does this help with that?
It does. That's the skin tightening. Oh. Yep. We have a lot of mothers that, you know, they're pregnant and they give birth, and then a lot of mothers, even though they lose their weight and stuff, they have that little like belly that they can't get rid of.
Yeah.
And it's perfect for that type of stuff.
Interesting.
Yeah, that's the majority of our people.
That's really good to know, because I have a lot of people that are always asking me, hey Steph, like what do I do if like I have this loose skin? And you know, for years I've always been like, you know, I think you're just gonna have to get surgery for it.
Right.
Because, you know, like you lost the fat so fast, you didn't allow the skin to, you know, tighten up with the journey, or you just had so much to drop that even if you did it slow, like you didn't allow it to, you know what I mean? Like that loose skin was gonna be there. But it's nice to know that there is another non-surgical procedure that you can do to be able to tighten up that area.
And again, Stephanie, everybody's an individual. I literally turned a guy away last week. It's weird, because this guy is actually he actually competes. He's, I think 53 or 54 years old. Wow. He competes in the Masters divisions, but he dropped so much weight that he's got probably about this much loose skin. And he asked me, he wants to do this, and I told him it's too much. I could take some of it away, but you're not going to get the result that you want. Yeah. You definitely need to get that taken off surgically, get it down, and then we can take whatever's left and tighten up a little bit. But when it's that much, it's not going to do miracles. You know, that's, again, the consultation is everything. I'm not somebody that's going to, you know, take your money and just, it's just not the way I am. I'm going to let you know definitely if it's for you, if it's not for you, and I'll turn business away because my reputation's, you know, more important than anything else.
100%. Yeah. I mean, I've already seen it with the results of different people that you coming in. I've seen it with my own results. So, I mean, I'm overall very, very pleased with the services that I've gotten here. So,
thank you.
You're welcome.
Yeah, glad you're happy.
But anyway, guys, I'll go ahead and tell you guys a little bit more about, you know, like my little transformation. So, stay tuned for the next video, which will be the tightening one. And I'll see you guys on the next one.